But when one dies and they're all connected together, it kind of causes these other cells to go dormant because they're connected all by this bipolar cell. And what the mechanism is for that, this is pure theoretical. If there's any ophthalmologists in the audience, are probably rolling on the ground laughing by now. But I think that's what's really going on. All right. And as they die off, you get this tunnel vision from RP, because all the rods on the sides, okay, are being turned off because they're not nourished, and then since they're all connected to one bipolar cell, or hundreds, depends who you read, 30 to hundreds are connected to one bipolar cell. This bipolar cell gets the signal that this one is dying off, and so he turns the others off, and this can spread very carefully, and you only get your central vision, and then it works its way into the cones. That's where the center vision occurs, and that's when they start losing all their vision. But normally the sides go out first. Now, we've been able to bring back night vision. But the first thing they notice is that they go outside and there's the sidewalk. They haven't seen a sidewalk since God knows when. And it's brighter and lighter. The lights become very bright, okay? And then, almost intolerably bright, and actually act as dimmer switches to dim down the rods, because they're much more sensitive than the cones in the daytime, so that that they don't overstimulate your visual cortex to quote unquote wash out the image. Now, if anybody in the audience remembers film had an exposure where the amount of light and the time exposed, there were certain limits for that film. And if you got too much light on a film, it just washed out the image. There's just this big splash of light and nothing else, because you overexpose the film. I think that's what happens when the rods go out. Now, I had this one patient that for 8 years she could only see white. And this may be, in my opinion, and there's a lot of disagreement on this, but this may be this overexposure by the immigrant cells and the horizontal cells not being able to put the neurotransmitters into the rods, and they're overexposing the visual cortex in your brain, so you only see white. So as we treat and get those immigrant and horizontal cells on board, then we get some night vision back, and the bright lights aren't as bright, and then we work on the central vision. And we've been very successful at this with a number of retinitis pigmentosa patients. And we have some videos. If you go to youtube.com and plug in Dr. Walter Campbell, you can look at patients that were visually challenged, and we got most, if not all, their vision back. So we hope that you take a close look at us and think about coming in. Let us treat you. Each patient is unique and different. Even though you have the label retinitis pigmentosa, it's a lot different in each patient, where it progressed, how it progressed, what's working, what's not working, what can be fixed. Now, we have an OCT eye scanner where we can see all what damage are in the 10 layers of the retina, and also look at the cornea in case that's been injured in some way. We look forward to hearing from you. I'm Dr. Walter Campbell. We're in Lauderhill, Florida. If you wish to contact us, we're at 305-760-2414. Look forward to hearing from you. God bless.